I am sitting here today with Dr. Smith, and Dr. Smith is visiting from Texas.
That's right.
And we treated you back in 2016, 7 years ago.
Yep.
And you were having quite a bit of low back pain that we determined was discogenic pain. It was pain from your lumbar intervertebral discs. And back then we injected bone marrow and fat into your lumbar discs. Tell me a little bit about what your pain was like back then and how you've been these last 7 years since we treated you.
Well, before coming here, the pinched nerve was quite severe. I was contemplating surgery. I wanted to avoid that as much as possible. So once I had the procedure done, it was extremely better. For me personally, it kicked in pretty quick. I've heard testimonials from Docere Clinic and other sources that it takes months and months. For me, it actually was pretty instant within a few weeks. I was back to my old self.
Great.
So that was great. And so I ultimately had an injury years after that. And so I had an emergency back surgery. Very, very small.
Yeah, I spoke to you
very
back then.
small.
Yeah.
And
You had a microdiscectomy, you had a big piece of disc poking out into the spinal canal.
And that relieved that severe pain as well. But that was years after stem cells. And now we're years after the surgery. So we're kind of into it now, and I'm getting some lingering issues. And so I've been wanting to do this for the past year or so.
Great.
And hearing about how you guys do it the new way.
Yeah, with the umbilical cord.
Really motivating to me.
Yeah.
Rehab, or not rehab, but just recovery time would probably be very minimal.
Much faster.
So I'm excited about that.
Much faster, yeah, because as you remember when we do the bone marrow and fat, there's a bone marrow aspiration site, there's a fat aspiration site, bruises spectacularly, it's sore. This is, I think you're going to be quite happy with this.
I'm excited about that.
Well, good. Well, let's see if we can do this today and get another 7 years out of it.
Great.
No more surgeries, however, please.
Oh, yes.
All righty, great. I'm so happy for you.